My name's Navin Verghese. I'm a consultant spinal surgeon here in Sancta Maria Hospital. I've been a consultant for the last 13 years. I also work in an NHS practice in Swansea Bay University Health Board. Over the past few years, I've also been the National Director for Spinal Surgery for Wales and the National Director for Orthopaedic Surgery for Wales, which is a role I hold on behalf of Welsh Government. Spinal surgery is a fascinating field. I was always very interested in neurosurgery as a medical student, but I soon found out after neurosurgical placements that my actual passion was more about the spinal part of neurosurgery. I also found orthopedic surgery fascinating, and spinal surgery is a great blend between orthopedics and reconstructive procedures of the spinal column, the bone parts of the spine, but also blending that with the neurosurgical elements by around the nerve roots, the spinal cord, and performing operations on that. So it's a great blend between neurosurgery and orthopedics. I think it's the best of both of those aspects, if you ask me, but I am biased. Most common things patients come to see me about are sciatica. So people use the term sciatica quite frivolously, but really what sciatica means is nerve root referred pain down the leg and going sometimes down as far as the foot. And that's quite common. And the common causes for that are trapped nerves in the lower back due to disc bulges, disc herniations, all means the same thing, and spinal stenosis, which is more degenerative and aging processes, which causes growths of bone pressing on nerves in your lower back. That's one of the most common things we see. We also generally see similar things, but which can occur in the neck. That then manifests with pain referring down your arm, what we term sometimes brachialgia, and that can be extremely debilitating. And then slightly less common, but more serious conditions such as spinal cord compression in the neck or in the middle of the back, known as the thoracic spine. That can be extremely disabling and can cause permanent harm, and even in extreme circumstances, paralysis. So generally, we see patients with those conditions usually caught relatively early so we can treat and reverse those problems. Occasionally, we see patients with generalized aches and pains in the neck and the lower back, general what we term axial pain, and for those conditions it's more about lifestyle interventions, pain management. Sometimes injections can help with those. It's rare that there will be operations we use to treat general wear and tear pain. Most of my bulk of my work as a spinal surgeon is to decompress and take pressure off nerve roots and improve radiating pain into the arms or legs. I take a lot of the complex tertiary referrals of the southwest Wales. Some of those complex operations can include correction of adult spinal deformities such as scoliosis or kyphosis. You may have heard about scoliosis in children and teenagers, but as it develops in later life due to wear and tear problems, the spine can collapse and cause squashing of the spinal cord and nerves. And due to the nature of as we age, things become more complex and more risky. That type of surgery can be extremely high stakes. Therefore, we only reserve for patients when they're in extreme conditions, such as losing use of their legs or arms, for example. In those cases, it can sometimes take operations over the course of 2 days. We may need to do an operation on the Monday, phase 1, and then phase 2, for example, on the Friday to reconstruct the spine. And it involves surgeries involving the front of the spine, which can involve going through the chest or through the abdomen, through the belly, and then supplementing that phase 2 with operations from the back of the spine to stabilize the rods and screws. And that can be extremely fascinating, extremely rewarding surgery. And again, one of the reasons why I went into becoming a spinal surgeon, but at the same time, it can be extremely high risk, high stakes, and high stress. But they are some of the more complex operations we do. In the NHS, again, we also perform a lot of emergency surgeries for spinal trauma, spinal cancer, and again, those can be extremely rewarding but extremely high risks and potentially dangerous surgery. In Sancta Maria, in the private practice, by nature of private practice, very rarely do we have emergency complex conditions, fortunately, but we still do some very high complexity surgeries here, such as lumbar fusions, cervical fusion surgery, where we place rods, screws and cages into the spine to take pressure off nerves and improve referred pain into the legs, the arms, and sometimes to improve back and neck pain. But on the whole, these are the type of complexities of surgery which we do in Sancta Maria, but more so in the NHS. Yeah, I've had a number of over the years. As gradually your practice builds up, you do tend to then attract more high-profile patients. I've had a number of TV presenters, for example, with referred pain to the extent that they can't perform their occupation, they can't sit or stand for prolonged periods. Some of these entertainment industry jobs are extremely challenging. It does involve a lot of time in front of the camera, not half an hour like I'm doing now, but it can be hours and hours in front of the camera, lots of travel, so on and so on. Lots of international travel, and these patients come to me in extreme pain to the extent that they can't perform their job. And I've treated a number of those with a great deal of success, and it's very rewarding then to see them back on TV performing their job pain-free without any grimacing. And it's quite interesting, you see them before they come to meet me. There's been one patient in particular, a high-profile TV personality, who my wife was saying, I'm sure there's something wrong with his back, he's grimacing, he's not looking comfortable on TV. Lo and behold, she was right. The patient came to see me, the same patient came to see me a few weeks later with a spinal condition, which I then was able to treat surgically here in Sancta Maria, and he's doing very, very well. I've had some high-profile sports people, cyclists, rugby players, and that's more of an obvious reason why they would come to see a spinal surgeon. On the whole, for elite level athletes, we try and avoid spinal surgery if we can help it, but we do offer the wider remit of injections, physiotherapy and advice for patients, and occasionally they do need spinal surgery to get them out of their predicament. And we've had a great deal of success treating very high profile international rugby players, and on occasions Premier League football players, Championship football players, again with a high degree of success. Key warning signs that something is wrong with your spine or your back. I divide them into two bundles. There are warning signs which suggest there's an impending nerve problem, such as spinal cord compression or impending major nerve issue. And those warning signs are things such as severe pain referring into your arms and legs, with associated progressive weakness in your arms and legs, progressive numbness, and in particular the red flag signs for a serious lower back condition are losing the use of your bowels, your bladder, loss of urine sensation, combined with severe back and leg pain. That may be a sign of an impending emergency problem such as cauda equina syndrome, which is where you have compression of all of the nerves in your lower back. That is a medical and surgical emergency, and if you do suddenly develop back, leg pain and or in association with bowel and bladder dysfunction, you must present to an emergency department. More subtle symptoms suggestive of a progressive issue which needs urgent attention and to book in for an urgent appointment, for example through your GP or here at Sancta Maria, would be if you're gradually but progressively developing increasing pain and numbness and weakness in your legs, or likewise in your arms, and that means that you should really seek urgent medical attention. But as I said, emergency medical attention would be if you're also having severe, profound and sudden onset of weakness or bowel and bladder disturbance. So that's this nerve issue. In terms of causes, there are certain symptoms and signs which suggest that you have a sinister or serious cause to your spinal pain. Almost everyone experiences neck pain and back pain during their life, and neck pain and back pain, which is there in the mornings, you get a bit of stiffness getting out of bed or getting out of a chair after sitting. For me now, sitting here for half an hour, I'll get a bit of backache as I stand up, and it's what we get unfortunately with middle age, and that's fine. We all get that, and that can be managed, and that's not an emergency problem or a serious problem. But if you start to get things such as pain in the middle of your spine at night time, or if you start to have spinal pain in association with any unexpected weight loss or fevers or sweats, again, that could be a sign that there's something more serious going on causing your pain. And so there are two sets of problems really. The problems which I just described suggest a major nerve issue, and then there's the problems which suggest maybe there's a serious cause to your spinal pain. Reassuringly, however, the vast majority of pain in your spine is benign and is caused more by wear and tear and benign causes for trapped nerves. The spine is divided into different zones of the spine, or different areas. You have the cervical spine, the thoracic spine in the middle. The cervical spine is the neck area. The thoracic spine is the sort of the rib cage trunk area in the middle, and then you have the lumbar spine, which is the lower back area. You also have the other two areas, which are the sacrum, which is the fixed part of your pelvis, the fixed bone you see right near the tailbone, and then you have the tailbone itself, otherwise known as the coccyx. The vast majority, approximately 70%, 5% of the work which us as spinal surgeons perform is for patients, and patients we see are for those with lower back troubles. Reason being is, just logically, the lower back is at the bottom of the trunk. It's a flexible part of the spine, a mobile part, so if it moves and it's taken a lot of weight, naturally it's going to deteriorate and degenerate. And from that, you then get trapped nerves, and sciatica, for example. So that's the vast majority of the patients I see. And the vast majority are treatable, benign, not sinister, and we can deal with it. Majority of the other remaining 25% is due to conditions of the neck. Again, for similar reasons. The neck is a very mobile part of the body, and because it's a mobile part, it can degenerate and cause trapped nerves, general neck pain, and so on. Far more rare are conditions of the middle, the trunk, the thoracic spine. Reason being is the thoracic spine has its own brace called the rib cage, and because you have a rib cage there, the thoracic spine is more protected, and therefore it's protected from wear and tear, degeneration, which again then leads me back to my previous point. If you do develop pain in the middle of your back and your thoracic spine, that is a relative red flag. That can be a sign that there's something more serious going on, because it's so rare to develop pain in the middle of your back. There are some more benign common causes for pain in the thoracic spine, which I haven't touched upon yet, but in the thoracic spine, if you are of a more mature age, and especially if you're female, then there is a possibility that it may be a sign of osteoporosis or osteoporotic fractures. That's a very common cause in ladies past the menopause, for example, developing thoracic spine pain. And that does obviously you need to seek medical assistance if you do develop pain in the middle of your spine. There are more serious causes, such as cancer spread into your spine, which can cause pain in the thoracic area. Cancer can also spread to other parts of the spine, but normally there's some associated more serious features with that. So I don't want everyone to think as soon as they get back pain or spinal pain that it's cancer, but it is something. If it persists and it doesn't settle and it gets worse, it's associated with any weight loss or fevers or any other symptoms, loss of appetite, for example, then that does need to be checked out by, does need medical assistance either through your GP or coming here to see us in Sancta Maria. I see a lot of patients who have exactly that same sort of history, where they've known family members who've had cancer which has spread to the spine. And interesting fact is about 10% of cancers which are identified are normally identified at the time they presented to the spine. So a patient will present to us with back pain, not the typical back pain, serious back pain, and waking them up at night and so on. And we do the investigation. It's a terrible scenario to be presented with. So not only do you have to tell the patient there's something pressing on this spinal cord and they're at risk of becoming paralyzed, for example, you then also have to tell the patients, and that causes, you think, is cancer. So it's a double whammy really for the patients. It's a terrible piece of news to break. But obviously this is more emergency presentations through the NHS, and yes, we can treat that, and that's more my role as an NHS consultant on call, and also my role as the Spinal Network Director. We've instigated a lot of new, novel and innovative interventions into the NHS in South Wales in particular, which hopefully have helped us, which is helping us identify patients earlier with spinal cancer and therefore treat them in a more definitive way, preserve their mobility and stop them becoming paralysed. So we've had a lot of success with improving the metastatic spinal cord compression service in South Wales over the past year. That's been through my national role. For any patients with spinal pain, be it in the neck, the lower back, or referring into the arms or legs, or if you have any concerns that you may be developing a spinal condition, then we're here to help in Sancta Maria. We have a great team, multidisciplinary team. Due to the nature of spinal surgery, it does involve not just the surgeon, it involves the physios, the radiologists, and we've been treating very complex spinal conditions here, the more simple and the more complex spinal conditions here in Sancta Maria for many, many years. So we're always here and happy to help.